So there is a state election on. Election day is October 26th. Voting is currently open. Part of Arafmi's job as the peak body for mental health carers is to try and let people who make the policy and help decide the funding know what your views are, and that's the people running to hold government, to win the seats in which you live. And Arafmi, we had a small couple of things that we put out in our newsletter, a couple of ways that you could engage directly with the candidates and the members of the areas in which you live. Obviously, we're just starting off on that, so there were just a couple of small ideas there, and they're still relevant if you wanted to engage with that. And for today, we invited the mental health spokespeople for Labor, LNP and the Greens to come along or send us a video message. And one came through for us in person, the Greens health spokesperson and the state MP for the seat of South Brisbane. We have Amy MacMahon here with us today. Thanks, Amy.
Hi, my name is Amy MacMahon. I'm the State MP for South Brisbane. I'm very happy to be here today. I'll also start by acknowledging that we're on the land of the Yagara and Turrbal people and pay my respects to elders past and present, and remember that this has been a place of community and connection and care for many tens of thousands of years. And a big thank you to the organisers for having me along today and the previous speakers. I'm really keen to get a chance to say hi to as many of you over morning tea as I can. Care and the welfare of carers is an issue that is very close to my own heart. My mother had a stroke in 2012, and very quickly myself and my siblings became primary carers and advocates for her. We have seen up close the limitations in our housing system and health system, the limitations in our mental health and drug and alcohol support systems, and the gaps in the NDIS. And while I can't imagine all the challenges that you're facing caring for people with often complex mental health illnesses, I know how hard you have to fight to get the basics for your loved ones, for appropriate housing, for an adequate NDIS plan, if you can even get onto the NDIS, for high quality healthcare, for things that shouldn't be so hard in a wealthy state like Queensland. We've heard about the immense contribution that carers make to Queensland, but we know that critical support for mental health carers like yourself, like more respite, social and emotional support, advocacy, and help navigating complex care systems for your loved ones. Each of these systems have been underfunded for decades here in Queensland. It has rested on the backs of incredible organisations like Arafmi, doing what you can with a relatively small amount of government funding, but it shouldn't have to be like this. While carers are struggling to get the support that they need, while families are struggling with basics like finding affordable housing or putting food on the table, we know that big corporations here in Queensland are making record profits. Just as an example, big mining corporations have exported $634 billion worth of resources over the last decade, but only paid 9% in royalties. 10 of the biggest mining companies in Queensland pay $0 in corporate tax. You will pay more tax when you buy a cup of coffee than these companies do. And under both Labor and the LNP, big mining companies have been able to get away with paying a relatively small amount in royalties, meaning that we don't have the resources that we need to invest in the services that we need. And governments will turn to us and say there just isn't enough money to build the housing that we need. There isn't enough money to expand and fully fund our health system and our mental health system, that there just isn't enough money to fund more services for Queensland. But we know that in an incredibly wealthy state like Queensland, we could be gathering so much more to be investing in the services that we need. The Greens have been pushing to see big corporations taxed fairly and for that money to be used to fund services, public homes, health and education. And as the era of fossil fuels winds down, we have been pushing to tax multinational mining corporations fairly to capture the massive profits that mostly goes abroad to set Queensland up for the future. We have a fully costed plan that would raise an extra $61 billion over 4 years. And one of the big things that we would invest that money in is more public housing to address the housing crisis. We know that with the relatively small amount of federal government payments for disability support pensions, the carers allowance and carers payment, we know that people with significant mental health issues and people who care for them are statistically more likely to be impacted by the housing crisis, be in unstable housing or even homeless. Since 2015, since the last change of government, there has been a 10% decline in the rate of social housing relative to our population. And this has real-world consequences. You are likely seeing homelessness in your own neighbourhoods. There are now more than 40,000 people with very high needs on the social housing waiting list, waiting on average 28 months to get access to housing. And likely a lot of the people that you are caring for have been suffering from the housing crisis as well. And in the meantime, the major parties have sold off public housing, slowed down investment in building new public housing, and largely the housing crisis has been left to wealthy private property developers. But they're not in the business of building affordable and accessible housing. They're in the business of making profit. We are pushing for the government to get back into the business of directly building housing with a publicly owned property developer to build 100,000 new public homes to rent and sell to Queenslanders at affordable levels to make sure that no Queenslander, regardless of your circumstances, is suffering from the housing crisis. Our plan would push for a public developer to build 100,000 new homes to break the boom and bust cycle that property developers and investors have over the housing system, clearing that social housing waiting list, fully introduce and uphold accessibility requirements in the building code, and we're also pushing for a cap on rent increases. We know that drastically increasing rents is pushing a lot of people out of their homes or pushing people out of their neighbourhoods, meaning people are further away from their community or the health services that they've been relying on. And not only do we need to see this kind of bold action to address the housing crisis, we need to see the state's vast wealth being directed towards things like expanding and fully funding our mental health system, funding more one-on-one support for people with mental illness and support for those who care for them. I got the chance to sit on a committee inquiry a few years ago looking into Queensland's mental health system. What that committee found was that Queensland's mental health care system was woefully underfunded. We had, at the time, the lowest per capita spending on specialist mental health services in the country, a much higher rate of suicide among young people. Mental health units in hospitals are often not fit for purpose, and we have a huge shortage in our mental health workforce. The inquiry has resulted in some additional funding for mental health and some systems reform as well, but we need a lot more investment in this space, and knowing how this wealthy state could be raising so much more money to invest in the services that we need. It's critical that our mental health system here in Queensland gets the funding that they need. Thank you so much for having me along today. I'm going to stay for morning tea, and I hope to get the chance to say hi to as many of you as I can. Thank you.
Thank you, Amy. And we are just about to break for morning tea, after which you're going to be in the lovely hands of Arafmi's Sue Goodwin. I'm calling her up early just to give you a little taster. Sue is Arafmi's lived experience advocacy team lead, which means that's a mouthful as well, isn't it really? But she has lived and or living experience of being a mental health carer. She is in the advocacy team working towards systemic change, and she leads the lived experience part of that. Sue also has a very impressive CV in education, social research and social planning, and Arafmi is really lucky to have her. And She's a yogi. And she's lovely to work with. Genuinely good human with good hair. Now I'm thinking she's such an overachiever. Really?